Hello, my name is John DeWitt, and I am Professor of Medicine in the Division of Gastroenterology and Hepatology at the Indiana University Health Medical Center, and I would like to discuss with you a recent publication we had accepted to gastrointestinal endoscopy entitled EUS-guided paclitaxel injection as an adjunctive therapy to systemic chemotherapy and concurrent external beam radiation for local or locoregional esophageal cancer, a multicenter prospective randomized trial. Stage 2, 3, and early stage 4 esophageal cancer has a very poor prognosis. Standard therapy includes chemotherapy and radiation, one regimen which includes 5-FU and external beam radiation. Because endoscopic ultrasound is used to stage these tumors, there's been some interest about whether or not injection of chemotherapy into these tumors may help local control and perhaps other endpoints such as survival. One drug that has been injected locally is entitled Oncogel. This is a special formulation of paclitaxel which is designed to stay locally and therefore hopefully produce greater effects locally than treatment with chemotherapy and radiation alone. A pilot study published several years ago in 12 patients showed that most had improvement in dysphagia, and therefore that was the impetus for this trial that I'm discussing today. This trial enrolled patients in 20 centers in 5 countries. Those patients considered were those with non-metastatic local or locoregional cancer that included stage 2, 3, and early stage 4. More specifically, patients with stage T2 or T3 and N1 disease were considered for enrollment. If they met inclusion criteria, then they underwent staging, CT scans, and endoscopic ultrasound. The Oncogel injected was done under endoscopic ultrasound guidance using a formula based on the tumor volume by cross-sectional area and the length of the tumor. The standard therapy was 5-FU and radiation. The patients were randomized to either 5-FU radiation alone or 5-FU radiation plus the addition of paclitaxel as Oncogel injected in a spiral fashion around the tumor. The primary endpoint for the study was local control as measured by a CT scan 12 weeks after therapy began and was interpreted by a blinded radiologist. The secondary endpoints included the pathologic complete response, survival, and adverse events for these patients. Patients in whom therapy was completed successfully after 12 weeks were offered surgery if they still met health criteria for the operation. Overall, 253 patients were consented for the study, and 154 patients were randomized to either Oncogel plus 5-FU plus radiation, which included 77 patients, or 77 patients to the standard of therapy alone, which was 5-FU and radiation without Oncogel. The analysis included 72 patients who were treated with paclitaxel and 65 who were treated with the standard of therapy, standard of care alone. For the primary endpoint, there was no difference in the overall response as measured by CT scan 12 weeks after treatment began. More specifically, tumor response was 12.5% in the paclitaxel group and 20.0% in the standard of care group. These values were not statistically significant. Interestingly, there was a greater pathologic complete response in the standard of care group at 26.2% compared to the standard of care group, which was, compared to the paclitaxel group, which was 12.5%. This value was statistically significant and completely unexpected to the investigators. Overall, other adverse events such as endpoints such as adverse events and survival were similar between the two groups. So the investigators concluded that the addition of Oncogel to standard therapy with 5-FU and radiation did not improve local control and survival in patients with local or locally advanced esophageal cancer. The administration of Oncogel was well tolerated without any significant adverse events. These findings were disappointing and added to the current literature, which showed that ablation of locally advanced pancreatic cancer with TNF array also did not improve survival, and call into question whether or not local ablation or local injection of chemotherapy can help patients in systemic cancers such as pancreatic cancer and esophageal cancer. I thank you very much for your attention.